Lower body strength and stability become increasingly important after age 50 for maintaining mobility, preventing falls, and preserving independence. Today we're focusing on one specific exercise variation called the wide stance squat, also known as sumo squat, which targets inner thigh muscles, hip stabilizers, and lower body strength through a wider stance than traditional squats. This variation can be particularly beneficial for older adults when performed with appropriate modifications and safety precautions. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new exercises, especially if you have knee problems, hip issues, balance concerns, or recent surgeries. Understanding wide stance squats for older adults. Wide stance squats differ from traditional squats by using feet positioned wider than shoulder width with toes turned slightly outward. This stance emphasizes different muscle groups including hip adductors, inner thighs, glute medius, hip external rotators, and core stabilizers. For older adults, this variation offers specific advantages: reduced forward knee travel compared to narrow squats, improved balance through wider base of support, targeted strengthening of muscles important for stability, and adaptable difficulty through depth modification. However, proper form and gradual progression are essential for safety and effectiveness. Benefits of wide stance squats for over 50. Benefit 1. Strengthening underused stabilizer muscles. After 50, certain muscles become weaker due to reduced use and age-related muscle loss called sarcopenia. Wide stance squats specifically target muscles that often weaken with age. Hip adductors, your inner thigh muscles, help control leg position and prevent knees from collapsing inward during movement. Weak adductors contribute to knee stress and unstable walking patterns. Glute medius muscles on the sides of your hips stabilize your pelvis during walking and standing on one leg. Weakness here increases fall risk and contributes to hip and knee problems. Hip external rotators help control hip positioning and support proper movement mechanics. Core stabilizers engage to maintain upright posture during the squat. By regularly strengthening these often neglected muscles, you improve overall lower body stability, reduce compensatory strain on knees and lower back, enhance walking stability and confidence, and build strength for daily functional movements. Benefit 2. Improving balance and proprioception. Balance naturally declines with age due to changes in vestibular system, reduced proprioception, decreased muscle strength, and less varied movement practice. Wide stance squats help address these factors through several mechanisms. The wide stance requires active stabilization throughout the movement, challenging your balance system. Controlled lowering and rising trains your body to maintain equilibrium during position changes. The exercise improves proprioception, your body's awareness of position and movement in space. Regular practice strengthens the neuromuscular connections between your brain and stabilizing muscles. Research shows that strength exercises incorporating balance challenges, like squats, can reduce fall risk in older adults when practiced consistently. Improved balance translates to greater confidence during daily activities, reduced fear of falling, better stability on uneven surfaces, and enhanced ability to recover if you start to lose balance. Benefit 3. Supporting metabolic health. Muscle mass naturally decreases with age, contributing to metabolic slowdown. This means your body burns fewer calories at rest, making weight management more challenging. Strength exercises that target large muscle groups can help maintain metabolic rate. Wide stance squats engage major lower body muscles including quadriceps, glutes, hamstrings, and adductors. These large muscles require significant energy, both during exercise and for maintenance. Regular strength training helps preserve muscle mass, which supports healthy metabolism. Additionally, building lower body strength improves your ability to stay physically active overall, whether walking, climbing stairs, or participating in activities you enjoy. This increased activity level contributes to better metabolic health. While no single exercise dramatically changes metabolism, consistent strength training as part of overall healthy lifestyle supports weight management, maintains muscle mass important for metabolic health, improves insulin sensitivity, and enhances overall physical function, enabling more active lifestyle. Benefit 4. Supporting cardiovascular health through movement. While wide stance squats aren't traditional cardiovascular exercise, they support heart health through several mechanisms. Large muscle groups require oxygen when working, gently increasing heart rate and circulation. This provides cardiovascular stimulus without high-intensity stress. The controlled nature of the exercise allows for steady breathing, avoiding breath-holding that can spike blood pressure. Regular strength training is associated with modest improvements in blood pressure, improved circulation, better vascular health, and reduced cardiovascular disease risk. For older adults who cannot tolerate high-intensity cardio, exercises like squats provide important movement stimulus supporting cardiovascular health at appropriate intensity levels. Combined with regular walking and other activities as tolerated, strength exercises contribute to comprehensive cardiovascular health maintenance. Benefit 5. Building functional strength and confidence. Perhaps the most meaningful benefit is how wide stance squats directly improve daily activities and confidence. The movement pattern mirrors essential daily tasks including standing from seated positions, getting on and off the toilet, entering and exiting vehicles, lifting objects from low surfaces, and maintaining stability during varied movements. By strengthening muscles and movement patterns used daily, you improve functional independence. This builds confidence in your physical capabilities, reducing fear of movement and hesitation during activities. Greater confidence encourages continued physical activity, creating positive cycle supporting long-term mobility and independence. Many older adults report that consistent squat practice makes daily movements feel easier, reduces reliance on arm support when standing, improves confidence during daily activities, and enhances overall quality of life through maintained independence. How to perform wide stance squats safely. Here's proper technique for wide stance squats with safety modifications. Starting position: stand with feet wider than shoulder width apart, approximately 1.5 to 2 times shoulder width. Turn your toes outward approximately 30 to 45 degrees, whatever feels natural for your hip structure. Stand near a sturdy support like countertop, chair back, or secure railing that you can hold if needed. Position yourself so support is within easy reach. Performing the squat: engage your core by gently drawing your navel toward spine. Keep your chest relatively upright and spine neutral throughout. Slowly bend your knees and hips, lowering your body as if sitting back onto a stool. Keep your knees tracking over your toes, don't let them collapse inward. Only lower as far as comfortable while maintaining good form. Even partial depth provides benefits. Partial squats to quarter or half depth are perfectly acceptable starting points. Hold the lowest position briefly, 1 to 2 seconds. Press through your entire foot, particularly your heels, to stand back up with control. Use arm support from nearby surface as needed. There's no shame in using support for balance and safety. That's 1 repetition. Starting guidelines: begin with 5 repetitions. Rest briefly. Complete 1 to 2 sets. Practice 2 to 3 times per week. Progress gradually over weeks by increasing repetitions to 8 to 10, then 12 to 15 as strength improves. Only increase depth if comfortable and form remains good. Never force deeper squats. Important form reminders: keep your weight distributed through entire foot, not just toes or heels. Maintain relatively upright torso. Excessive forward lean increases lower back stress. Move slowly with control. Quick movements increase injury risk. Breathe naturally throughout. Exhale as you stand, inhale as you lower. Stop immediately if you feel sharp pain, particularly in knees or hips. Essential safety modifications: for very limited mobility or strength, perform supported squats holding countertop or sturdy furniture throughout movement. For balance concerns, position yourself in corner where 2 counters meet, allowing hand support on both sides. Place sturdy chair behind you so you can sit down if needed during practice. This provides psychological safety net. If squatting to parallel is too deep, start with quarter squats. Even minimal range provides strengthening benefits. For knee sensitivity, limit depth to pain-free range only. Partial squats are valuable. If standing squats are too challenging, practice sitting down and standing up from progressively lower chairs. This builds similar strength. Who should avoid or modify significantly? You should not perform wide stance squats without medical clearance if you have recent knee or hip surgery, within past 6 months without surgeon approval, severe knee arthritis with constant pain, acute knee or hip injuries, significant osteoporosis with high fracture risk, severe balance problems making standing exercises unsafe even with support, or uncontrolled cardiovascular conditions. Consult your healthcare provider or physical therapist if you're uncertain whether squats are appropriate for your situation. Realistic expectations for progress, strength and functional improvements from wide stance squats occur gradually. Weeks 1-4, learning proper form and technique. Initial muscle soreness, which is normal. Beginning to establish routine. Some may notice slightly improved confidence standing from chairs. Weeks 4-8, movements feeling more natural and controlled. Noticeable improvements in lower body strength. Ability to perform more repetitions or slightly greater depth. Improved balance during squat movement. Months 3-6, clear improvements in functional strength for daily activities. Better stability and confidence during movement. Established sustainable practice with continued gradual progress. Enhanced ability to perform daily tasks requiring lower body strength. The goal isn't rapid transformation but gradual sustainable improvement supporting long-term mobility and independence. Integrating into daily routine. Wide stance squats work well integrated into daily activities. Practice while waiting for morning coffee to brew. Perform a set during TV commercial breaks. Include in morning or evening routine after brushing teeth. Practice before or after daily walk. The key is consistency over intensity. 2 to 3 times per week with proper form is better than daily practice with poor form or excessive fatigue. Complementary exercises. Wide stance squats work best as part of comprehensive routine including regular walking for cardiovascular health and overall mobility, upper body strengthening exercises for balanced fitness, balance exercises like standing on one foot with support, and flexibility work for hip and lower body mobility. No single exercise addresses all aspects of healthy aging. Varied movement provides best overall benefits. Conclusion. Wide stance squats, when performed with proper form and appropriate modifications, offer valuable benefits for adults over 50 including strengthening often neglected stabilizer muscles, improving balance and proprioception, supporting metabolic and cardiovascular health, and building functional strength for daily activities. Most importantly, they enhance confidence and independence through improved physical capability. Start with modifications appropriate for your current ability. Use support without hesitation. Progress gradually based on how your body responds. Practice consistently 2 to 3 times per week. Listen to your body and stay within comfortable ranges. Combined with regular walking and other healthy lifestyle practices, wide stance squats can contribute meaningfully to maintaining strength, stability, and independence. Thank you for watching. For specific concerns about whether wide stance squats are appropriate for your situation, consult with a physical therapist or healthcare provider for personalized guidance. Subscribe for evidence-based information on strength training and functional fitness for older adults, practical guidance that prioritizes safety while helping you maintain mobility and independence.